Dr. Reges, Brazil recorded its highest daily rise in deaths so far on Tuesday. The president's stance, as we all know, has been very clear. But how are Brazilians in general viewing this pandemic at the moment? And do you think most are taking it seriously?
Hello. So, to be honest, it's been quite hard time to be Brazilian. It's quite hard to be Brazilian because we are not seeing a crucial political guidance on what should be done regarding all this pandemic and of course, evidence of raising numbers. This is hard because the population in general in Brazil do not have that much knowledge in health literacy. So we cannot demand and ask of most of the population to report and to behave as they are expected to be. And this makes everything quite harder when you have all the politics kind of arguing and you don't have a national unity on what's supposed to be done. Of course, we have been seeing through all the cities and social distance measures, but through the last weeks, we've seen the weakening of all of these measures. We've seen traffic jam and people walking on the streets, even in few cities like here in Rio de Janeiro, where masks are like obligation for all the population while they are in public situations. So it's been quite hard because you don't see a quite unique position. So you don't see the unison of all the population and what it's supposed to be the common enemy, that is the COVID-19 right now.
And Dr. Reges, how would you describe testing in Brazil, access to testing, supplies, and other medical equipment? Are hospitals there ready?
Yeah, we've seen all the importance of testing and testing and testing. And of course, we know that even with these high levels of mortalities and the number of cases, of course, it doesn't represent what is the reality. We know that unfortunately, there are many other deaths and many other infected people. So of course, tests are important. The point is also kind of related with technology transfer. We don't see here in Brazil all the needs for producing the tests and the kits. For example, in the foundation I work for, of course, that we do try to produce more test kits and make it available for the whole population and make it available in different parts of the country where it's needed to be tested. But you still need to follow kind of political guidance, not political in terms, but you need to find like the policies and the guidance and prioritize population that should be tested because we have limited equipment and limited time and limited like supports and supplies for doing so.
And we're running out of time, but one quick last question. How would you say Latin America is faring overall with COVID-19, and how much coordination is there between other countries in the region?
Yeah, and so we know that it's quite hard to talk about Latin America as a united body of countries because there is a lot of disparities, a lot of social inequalities that make each country quite unique. In fact, as we've seen like in European Union, you do have a more united decisions being taken that you don't see like here in Latin America specifically. But the point is that we have countries in different times of the epidemic and of the pandemic itself. So if it's hard to control and like only one country, it's even harder to understand what is going on in all the countries all over the continent. So what is important is that you have like sharing information, that you have all these agreements between the countries because we share borders and the virus doesn't see borders. So it's important that we can prevent and not making new epicenters of the disease, and especially in countries with weaker health systems that can like face many more and many other consequences of all of this.